I got my breast cancer diagnosis. We're going to have a meeting with your treatment team. Before that day it actually happened, I got to meet with Dr. Simmons. It was very nice. I felt very secure that I had a good leader there. I had someone that was going to be my general to help me through this, help orchestrate the rest of my team for all of this. And that was a very important thing for me as a patient. Even though I have some medical knowledge, it's scary. And I felt, all right away, someone's got my back.
Well, the way I think about shared decision-making and the way I try to explain it to other people is that it's not taking away your ability as a doctor to make a recommendation to a patient. What it does, though, is it lets you make a much more informed recommendation. There are going to be treatment choices and decisions to be made in someone's healthcare that are really, to make a good decision, it's going to require that we know what things really matter to them. The listening portion of this is something that I'd like to get across, because that's where it all starts. For example, when I think about how important it can be to really listen to someone, I think about Juli and how she brought up to me in conversation how important it was to her to continue to play her bagpipes.
I think you taught me a lot about remembering that the point of being treated for a cancer is so that you can live your life really fully. But you play music, mm-hmm. and you play in a
bagpipes,
and and you very much wanted to make sure that you weren't having too much pain to carry bagpipes and march. And I thought, of course, that is really important here. We need to make sure, however you approach your treatment, that it's going to give the best chance at keeping you active and able to do that.
And I really hadn't thought about how that was going to be maybe a problem after surgery, but she explained to me that there was potential that it would be because of the location for operation and where she holds the pipe.
The surgery part for me, my bilateral mastectomy, but I had a lot of lymph work. You can only have a bagpipe up and under this arm. And not only was, I want to play my music, but it's a great distractor for me. It's a great comfort for me to get out with my band and to play. And this was a huge part, I won't be able to play bagpipes.
And what I was really glad about was that she'd communicated that well to her surgeon and that they had listened well and worked hard to get a treatment plan that was going to have the least impact on her ability to play.
Eventually could get back to it, and just sticking that thing under that very tender area. And
didn't eliminate it. It still had some impact, but they really heard what she was trying to say, and they realized that unless they kept her needs to stay whole and be able to do the things that she needed and loved to do, if they didn't get that part right, the rest of her treatment might not go as well either.
We had to play with that a little bit to get it to work, but you got where I was coming from. That's also part of how I deal with my stressors, is playing music.
I think about that as a really good example of when somebody's trying to tell you something, they're not just talking about their hobby. This is really important that you know this about them so that you get them feeling well, in the end and coming through treatment, a whole person. So I think that's one of my favorite examples of listening to people.